Even our most peak fertility, which is in our 20s, we never have greater than a 25% chance of getting pregnant spontaneously in that month. In my 20s, I was like, dear God, I hope I'm not pregnant. And then my 30s, I'm like, dear God, let me get pregnant.
We spend most of our life preventing it, and then all of a sudden we want to get pregnant, and then it's like, okay, off the pill or whatever, like let's just try right away.
Good. I tell patients it's not like chicken in the freezer, right? You don't open it in a couple of years and be like, oh dear God, how did I not throw that away? Once they're submerged in liquid nitrogen, they're good to go. And like all you should do is cardio and run, and that was how you were going to stay fit. That is so not true.
Hormonal health, and there's so many environmental things against us now. It's like we got to stay strong.
We need to learn about what our body is doing.
As women, we're told to wait for the right time, the right partner, the right season, and yet no one really talks about what it means for our fertility. Today, I'm joined by someone who's helping women take back that conversation. Dr. Jaime is a board-certified reproductive endocrinologist, the Director of Fertility Preservation at CCRM Fertility of New York, and the author of the new book coming out, Own Your Fertility. She's one of the leading voices in reproductive medicine, known for her compassionate, evidence-based approach that empowers women to make informed, confident decisions about their bodies and their futures. Dr. Jaime, thank you so much for being here. To kick us off, I'd love to know, as someone deeply immersed in fertility medicine, did you ever have like a personal wake-up call to this field, or how did we get here?
Yeah, that's a good question. So I joke around that I knew I wanted to be a doctor since the age of 8. In second grade, I read this book about Elizabeth Blackwell, the first female doctor in the US, and I was like, that's what I want to do. Initially, I thought I wanted to be a pediatrician, like when I was young. Then I got into college and I thought, well, what I really want to do is women's health. So I took a gap year between college and med school, and I worked at Sloan Kettering in their breast center, and I thought I wanted to be a breast surgeon. I later learned that to become a breast surgeon, you have to do a lot of GI, like a GI residency, a GI surgical stuff. And I was like, I don't want to look at like poop and all that stuff all day. So I was like, I am going to go and do what I really want to do, which is OBGYN. And then once in OBGYN, I was fascinated by hormones and found my way into a fertility fellowship.
Amazing. Okay. So are you from the East Coast? Did you kind of stay out there, went to school out there, found your like job out there? You're in New York City, right?
Everything. So yeah, I left for 4 years. I went to Philly for undergrad. But other than that, was always in New York. Went to med school here, residency, fellowship, all of it. So I've been pretty much a New Yorker my whole life.
Amazing. So when you first got into fertility medicine, is it the way you practice now, or have you kind of like evolved your practice over the years? And what does that look like now compared to what it was?
That's a very good question. So I used to tell people I was an infertility doctor, and now I tell people I'm a fertility doctor because most of my days are spent helping women and couples preserve their fertility rather than treat their infertility. And this shift was really an impetus for why I wrote the book, quite honestly, because I was like, wow, the way we practice is so different now. We can actually be there can be a game change in infertility. And that motivated me to write the book.
Amazing. So what, because I think a lot of people assume fertility is something that they have to think about later. Like when I was in my 20s, I was preventing pregnancy. I was doing everything I can, like on hormonal birth control until I was about 25. Then I was like, I gotta get this. And then, so we spend most of our life preventing it. And then all of a sudden we want to get pregnant. And then it's like, okay, off the pill or whatever, like, let's just try right away. So when did you start helping women realize that they need to have these conversations, like maybe in their 20s, and they need to kind of start preparing before it's like go time?
Well, I'm laughing because last night I went to speak to a bunch of undergraduate women about fertility, and we talked about this. And I said, when I was your age, in my 20s, I was like, dear God, I hope I'm not pregnant. And then my 30s, I'm like, dear God, let me get pregnant, right? Because I think we think it's going to be much easier than it actually is, right? Even our most peak fertility, which is in our 20s, we never have greater than a 25% chance of getting pregnant spontaneously in that month. So I think we have a misconception that we're just going to try and it's going to happen. And while I definitely don't want young women to run around and get pregnant accidentally when they're not ready, I do think it's important to know that actually getting pregnant is pretty hard, and human reproduction is actually pretty inefficient.
Wow. Okay. So obviously fertility metrics, like when it comes to getting pregnant, it's very obvious how we get pregnant, right? So when you're talking about preparing, like what does that look like for someone that's preparing? Like, because it's like kind of hard to get pregnant for some people, maybe really easy. Like I always heard like my sister-in-law, she's like, I sneeze and I get pregnant.
I know those people are sort of annoying, to be honest,
Yeah.
because you're like, great, thanks. I'm so happy you said that. But the reality is, you need to know your body, right? You
Yeah.
need to know. And I spend a lot of time saying to women, I'm like, you have two ovaries, you have two fallopian tubes, most cases you have one uterus. And learning when last night a very educated woman said to me, so when I get my period, is that my egg coming out? And I was like, no, that is not your egg coming out. That is your uterine lining shedding. So I think we sort of need to do like a redo of biology or redo of sex ed,
Yeah.
right? And that's
Yeah.
what we put in the book. We call a chapter "Not Your Mom's Sex Ed Class" because we need to learn about what our body is doing. Also, there's many ways to have a family, right? It's not just heterosexual intercourse, right? You can, two men, two women can have a family. And so there's a lot of different things we need to teach people so that they're aware.
Yeah. So let's talk a little bit about your book. The title is called Owning Your Fertility. So
Own your fertility. Yep.
what is it like, what does it look like to own your fertility? How does somebody really optimize their body, and when do they really need to be educated to optimize?
I mean, I think we should be educated the whole of our lives, right? We teach our, daughters or the young women about what it means to get a period,
Yeah.
right?
Yeah.
Now we're starting to teach women about the end of periods, which is why menopause has become so popular. But there's a big chunk of time in between that we need to know about. And I think this education should really start in high school about what's going to happen to your body, right? Because people are fascinated when I say, did you know you were born with all the eggs you're ever going to have? And they'll say, no, I had no idea. Did you know that by the time you hit puberty, 12, 13, 14, you're down to 350,000 eggs? No, I had no idea. So I think these are facts that should be taught at younger ages. And did you know there is something you can do to reduce the chance of having infertility down the road, which is freezing your eggs?
Wow. Okay, I want to get into freezing your eggs because obviously I kind of knew about it like growing up. I'm like, "Oh, I've heard of it." And then now I'm seeing a lot of more, like maybe just cuz I'm in the women's health space, but I see a lot of like companies that offer it and influencers that are doing it now, especially in
Mhm.
their early 40s, late 30s. Maybe they don't have a partner yet. So, what does the process look like? Because it seems like it's kind of confusing. Maybe there's some fear around it. Let's just kind of
Yeah.
clean that. Like, let's go uh, egg freezing 101. What does it look
Yeah.
like?
So that's good. You're still telling all the chapters of the book. It's amazing. So
Okay,
it's
perfect.
like I'm going to take you on the road with me. So
All
egg
right.
freezing, what you have, it takes usually about 2 weeks, right? So the first misconception is that it takes months and months. It actually is fairly quick for most women. It does require hormonal injections, right? Medicines that you give yourself at home to stimulate the ovaries to produce multiple eggs. But are the shots painful? I mean, nobody likes to give a shot, but they're not what they used to be. You do have to commit to your fertility doctor as a commit, for a couple of weeks because we need to monitor your ovarian response to the medication. So we need to check your hormones and we need to do ultrasounds. And then the culmination of the procedure is the extraction of the eggs, which we call the egg retrieval. During the egg retrieval, we use a vaginal ultrasound to extract the eggs with the needle. Once the eggs come out, they are analyzed in the laboratory for maturity. We want to know how many of those eggs are at the stage that they need to be to freeze, right? Because we don't freeze every egg. We don't freeze eggs that don't have the ability to be fertilized down the road. And after that point, after we know how many eggs we were able to freeze, that's where we have like a real, like, break it down conversation. How old are you? How many eggs did we get? How many eggs were we able to freeze? How many kids do you want? Where are you in your life? Because those things go into play when we're trying to decide, should we do it again? Is that enough? And what should we do next?
Okay. So, what does the process of the freezing look like? Like, how long do they last?
So that's good. I tell patients it's not like chicken in the freezer, right? You don't open it in a couple of years and be like, oh dear God, how did I not throw that away? Once they're submerged in liquid nitrogen, they're good to go. you will have an expiration date for when you can get pregnant because we don't recommend women getting pregnant really above the age of like 52, 53. So you'll have a point at which you won't be able to use those eggs in your own body, but the eggs themselves will not expire.
Interesting. Here I am thinking like they're gonna expire in the back of the fridge is something you forget about.
A lot of people think that in some countries, not the US, there are mandates to how long eggs can remain frozen, right? Because in some countries, like the government will pay, but you can't have the egg stored for more than 8 years, et cetera. That is not the case here. So you could freeze eggs at 22 and not use them until 42 if you chose.
And what does that look like for as a woman who's older and like the egg itself, like it doesn't, it's just good to go, like by the age of 42, and now you have this like ripe young egg inside of you
Yeah.
ready for
So
a
I'd say
baby?
it's almost like I tell women you're serving as your own egg donor, right? Because if you experience infertility where your eggs don't work at 42, but you froze your eggs at 28, we can pull those eggs out of the freezer and be like, okay, your 28-year-old self is donating to your 42-year-old self.
Oh, when she's in her prime. I love that.
Good way to do it.
Okay, so then egg freezing can obviously be for the person that obviously donates them to themselves, but it can also be for other people. And you talk a lot about in your book surrogacy as well.
So we do discuss surrogacy. So surrogacy is when a woman cannot carry a pregnancy, or let's say in a same-sex male couple, there is no uterus, and an egg and a sperm come together, they make an embryo, and an embryo is carried by another person, which is called a surrogate.
Hmm. So they can utilize their eggs that they froze with sperm from maybe their partner and then put it
Correct.
into obviously another woman.
Exactly.
And that
If
is
they
getting
need to.
way more common as well. I see a lot of younger
Yeah.
females carrying for other couples.
It's definitely, I mean, here in New York State, it is because it was not legal to put an embryo into a surrogate paid until 2021. So we didn't see it a lot, right? Because we weren't able to do it. Now we are. Now, all but two states in the US allow paid surrogacy, right? So Michigan just changed their law in 2024 also. And so it's definitely more common now.
I did not realize that it was not something that was like mainstream all
Yeah.
across the board.
Yeah. And most countries, it's not legal.
Makes sense. That makes sense. We have a lot more freedom over here. Okay. So when you're talking about fertility, so what does like a day in the life of your work day look like? Like, what are you helping women with? Are you mostly doing like egg freezing or like what are all
It's a
the other options that people have?
Yeah, it's a good question. People ask me this a lot. Some people I'm like, I don't know if you'd want to do my job, but I joke around. I'm like, I wake up very early so I can work out before work. I try if I can to take my kids to school. And then I get to work, and my day is filled with a lot of procedures. I do ultrasounds, egg retrievals, and embryo transfers, right? I do a lot of different things with my hands, basically. And I see patients who are there to either freeze eggs, freeze embryos, or treat infertility. So I get to do see a lot of different types of patients in one day. The nice thing about OBGYN, and if there's anyone listening who's like, I want to be a doctor, but I don't know what kind, OBGYN allows you to do medicine, right? To meet with patients, to give medications, but also surgery. We can, do C-sections. We can operate and take uteruses that we can do a lot of things. So it's like a nice marriage between both.
Amazing. So you also do infertility treatments.
So I
So
do
what,
infertility treatments for couples or individuals who are experiencing infertility, correct?
and this is before they even want to explore the option of maybe, or maybe they don't have the option of egg freezing. Maybe
So
it's
I
not a
will
good
see
option, right?
couples who may come in at 36 and they say, I'm just trying to think of patients I actually saw today, 36-year-old couple. They've been trying to get pregnant for 8 months and they are unsuccessful. So that couple is not there to freeze fertility. They're there to treat their infertility
Hmm.
versus the person that I saw before them who came in at 33 who was single and wanted to freeze her eggs, right? So those are different patient types. There's infertility and then there's fertility preservation.
Got it. Okay, so let's break down for the listeners what IVF is, IUI, and is there another one, a couple others that I'm missing at
Yeah.
all?
So I describe it in my book, and also I just how I explain to patients. I think of it as a ladder, right? So when you start at the bottom of the ladder and you're trying to get pregnant, you're just having unprotected intercourse. Hopefully, you're having intercourse around the time that you're releasing an egg or ovulating, but you're just having intercourse. If you come into our office to seek fertility treatment, frequently we start one rung above, which will be an oral medication called Clomid or letrozole, which is a tablet combined with an IUI insemination. So in these procedures, we'll have sperm that will bypass the vagina, bypass the cervix, go right into the uterus. So it's almost like giving the sperm a head start before the race, the gun goes off. So that's like one step above. If that is not successful, frequently then we'll go to IVF. Now, IVF stands for in vitro fertilization. That just means egg and sperm come together in the lab. But the interesting thing about IVF, embryo freezing, egg freezing, the first half of all of those three things is exactly the same. You take the same shots, you have the same blood test, and the eggs are extracted in the exact same way. Where things change, I always say, think of like a sports game, right? You have first half, second half. Where things change is at halftime. If you're freezing eggs, eggs are frozen when they come out. If you're making embryos, either for embryo freezing or to do IVF, egg and sperm are coming together and they're growing in the laboratory, and either the embryos will be frozen or the embryos will be put back into the uterus. So a lot of people get confused about, they're like, oh, wait, it's all sort of the same. In many ways it is. It's just the intent can be different. Am I freezing or am I treating? And am I freezing eggs or embryos? It can be different.
Wow. Okay. And I hear like a lot of rounds of these things, right? Like they need IUI a few times, they need IVF a few times. And so when are you opting to, because what is maybe I've heard this before, is the definition of infertility is like a whole year of trying? And
So
then
that has changed. So in
okay.
2023, the American Society of Reproductive Medicine changed the definition of infertility. So now it's much more expansive. So what it says is trying for a year if you're under the age of 35, trying for 6 months if you're greater than the age of 35, or anyone who doesn't have the opposite gametes. So if I'm a same-sex female couple, historically, my insurance company would say, you're not infertile. You and your partner haven't tried. But how are we supposed to try for a baby? We don't have the opposite gamete. So now we would be deemed infertile from the get-go. What if I was a single woman who wanted to use donor sperm? I would not be considered infertile. And all of these things limited my ability to access my benefit. So now the definition has changed such that it's more expansive and more people can come in and access treatment, so that 1 year of unprotected intercourse is antiquated. And we only use that in certain situations.
Right. Probably for more like insurance related coverage, or is IVF not covered by insurance?
Some insurance companies will cover it if infertility is proven. So my job as a fertility doctor is to help patients, quote unquote, prove their infertility. So if I see a same-sex female couple, I'm going to say, okay, this couple is infertile because they don't have the opposite gamete, and you are using the old definition.
Right. That totally makes sense. So I want to go back to egg freezing because you brought up a point about the frozen egg. What does unthawing look like? And walk me through that. I'm trying to picture this.
So let's say I freeze my eggs at 28 and I get 14 eggs frozen. And then I come back at 34 with my partner and I say, we've been trying for 8 months and we're not pregnant. And somewhere along the way, we had a miscarriage and we want to use my frozen eggs. So I would thaw those 14 eggs. I would fertilize those eggs with that patient's partner's sperm and create embryos. And the same growth that happens in the laboratory when you're doing IVF or embryo freezing would happen in the lab with embryo freezing.
Got it. Wow, there's just so many options for women. Are these all accessible? Like, is egg freezing accessible for everybody, or is it like an extra expense?
Yes. So I can't say it's accessible for everyone because that would be unfair for me to say. But I would say it's accessible for many and many more as, the days go on, meaning it used to be a complete out-of-pocket expense. Now it isn't a complete out-of-pocket expense. A lot of companies will cover it, and therefore women can do it on their insurance plan. And so that is way more accessible than it ever was.
Okay. So for women who are listening who might not be trying to conceive right now, do you think the first option is egg freezing? I mean, or is it just let's just wait and see?
No, I mean, if you hang out with me and my daughters, they're going to be like, oh, our mom is telling us to freeze our eggs at 22. And the reality is the younger, now listen, I get it.
Yeah.
It's like the what do they say? The cobbler's kids have no shoes or whatever. But the point is like, I'm a fertility doctor. So of course I'm going to talk about fertility all the time to my daughters and tell them that they should consider freezing their eggs when they're, in their 20s, because I've seen the worst of what can happen if you don't do that. But I do think every woman should at least have a fertility evaluation in their 20s and talk to a fertility doctor about their reproductive future.
Mm-hmm. So I think so many women don't even know what like tests or like markers to even be looking for or asking for. So can you walk us through what you recommend women in their 20s to like kind of check to understand where
Yeah.
they're at?
So we want people to get an assessment of their ovarian reserve. So ovarian reserve is the medical way or the fancy way of saying egg quantity. We want to know, how many follicles do you have? So follicles are the shells that hold the eggs. So eggs are microscopic. Nobody could see them except for the men and women that work in the laboratory. But we can see follicles, the shells that cover them. So if we do an ultrasound, we can count the follicle number. And if we do a blood test, we can measure a hormone that is made by the follicles. So these two parameters are good ways to assess one's ovarian reserve. Now, ovarian reserve assessment does not tell you if the eggs you have are good or bad, right? It doesn't tell you about your quality. It doesn't tell you if you're fertile or infertile.
Just as you
But
have.
exactly. And if your egg quantity is low, I or a fertility doctor might say to you, hey, your fertility, your quantity of eggs is lower than it should be at the age that you are. I don't know if that means you're going to have infertility, but I do know that it means you might. So if you were considering egg freezing, I would do it sooner rather than later. And I would also consider maybe doing more than one round to collect enough eggs that you feel comfortable for your future.
So ovarian reserve, and that's a blood test that they can blood test. Okay, and anyone can just go get that done. Ask their
Your
doctor.
OB/GYN can do it. And also,
Okay.
I think like it's not just a measure. And I tell people this, like, I want to know about your mom's fertility. I want to know about your aunts. I want to know if somebody in your family carries a genetic mutation that we may want to test for in an embryo. I want to know, do you have fibroids that you may need to have surgery? So, like, it's a real in-depth conversation so that we can plan about your fertility future. I also want to know, do you have benefits to do this? And if so, are you planning to leave that job anytime soon? Because we want to take advantage of it. Also, do you want 4 kids? Because if you want 4 kids, you may need to do this more. Like, it's a
Yeah.
full on dialogue.
Right. So what's a typical ovarian reserve number that people should be like, okay, I think I'm in the range of good, I
It's
guess.
it's definitely age dependent, right? People
Okay.
ask that all
Okay.
the time. They're like, is this good? Is this bad? And I'm like, well, it's very age dependent. So the younger you are, the higher the number should be.
Got it. Okay. And then you're saying you can see follicles. So how many follicles are holding eggs inside?
So every follicle should have one egg, right? So when you're in a regular menstrual cycle, my like spontaneous menstrual cycle, right? Every month I'm going to ovulate one egg, right? That's the way it normally goes. But when you are doing a round of egg freezing, embryo freezing, whatever it may be, we want all of the follicles that were racing to be the one egg that's ovulated. We want them all to grow and come along for that cycle.
Mm. This is so good. I'm like learning so much. I'm like, I learned this in physiology, but like that was so many years ago. And I'm like,
Well,
I
that's
did
the
not know
thing.
the extent. Yeah.
Most of us don't know because it's
Oh, not at
it's just
all.
not our everyday, right? And because it's
No.
not our everyday, like, I mean, I'm joking around, but like I'm so bad at technology. I'm like, how do I even log on to this Riverside platform or whatever? Like, because
Yeah.
it's not my everyday. And probably someone would be like, she's so dumb. Like, of course, you just click the button, right? But like,
Yeah.
we don't know what we don't
Yeah.
know. So that's why we turn to people to help us.
Amazing. So I'm curious. So, as far as like the egg retrieval process, the process of getting pregnant, right? At what point, say they do get pregnant, like, do they have to continue with any other medications and hormones and like to
So it
continue
depends on how,
optimizing?
yeah, it depends on how the embryo was put back into the uterus, right? So if you use somebody's like natural menstrual cycle and you just timed it when they were ovulating, you would put the embryo back in a specific time and they wouldn't need as many hormones after. But if you were doing something called a medicated transfer, then you might, right? So it depends on how we prepped to put the embryo back in. But usually at about 8, 9 weeks, all the meds are the same as it would be for anyone who got pregnant.
Got it. Awesome. Well, I'm super excited to learn more about your book because I'm sure you break down a lot of these things in your book. So can you tell us a little bit more about Own Your Fertility? What sparked the interest to write it?
I joked around. Okay, so I told you when I was in second grade, I was like, I want to be a doctor. I was like, if I'm not a doctor, I want to be a writer. Okay. So I always thought like I was a pretty good writer. I thought like I liked writing essays. So I thought, okay, I'll keep that in the back of my head. And then as I started to see the dynamic shift from infertility treatment to fertility preservation, I was like, I should really put that to, start to write because I felt I can only talk as loudly as I can in the four walls of my office, but I wanted to share what I knew with so many more people. And I kicked this idea around. I have a very good friend who I told this to for years, and she finally was like, I'm so sick of hearing you talk about it. Just do it. I was like, oh, maybe she's right. And then she connected me to a woman who became my collaborating author and a dear friend. And together we wrote the book.
Amazing. So when is it releasing?
January 13th, 2026.
Cool. Are you going to
Who
go
would
on?
have thought the 13th would be like a day that, well, Taylor did change how I felt about the number 13. So I got to be honest there. I was like, well, it's good luck because it's her favorite number. But are we going to go on a book tour? Probably not, but we definitely we'll do some parties to celebrate.
Absolutely. That's so exciting. I can't wait to read it and I can't wait to share it with other people because this is such an interesting topic where a lot of people are educating about infertility, but not a lot about fertility. And
Well,
it's
and
on the rise
yeah.
right now. Like I said, I was like, I'm seeing a lot of influencers freezing their eggs, talking about it, working with companies. I'm like, it's coming, it's happening.
It's definitely become a more in vogue thing to do, and something. And I do credit people freezing their eggs. They've changed the conversations around fertility treatment because it used to be people would sit in our waiting room, very like hiding hats. There was shame, there was embarrassment, there was guilt, and
Yeah.
now because there's so many women doing this proactively, being like, yeah. I'm a badass and I'm here to take this into my own hands. There's been like a pick up your head and be proud of what you're doing moment. And that's really powerful.
Amazing. It absolutely is. So if you could change one thing about our healthcare system right now, around women's fertility, what would it be?
It's a great question. I think I would want just the coverage to be more expanded, right? So that everyone has access to it. Not just awareness, but also access and the ability to do it.
Yeah, especially because I was asking about like the egg freezing. I'm like, I don't know if everybody's going to have the opportunity to be able to do something
Right.
amazing
I
like
mean,
that.
this, not everyone will. More and more people will. And I do tell young women now, when you take a job, ask to see what the benefits are. You would be very surprised at how many companies will offer it where they hadn't offered it in the past.
That's great. We're moving in the right direction. I love to hear
We
it.
are.
All right, last couple questions for you. What's one rule, piece of advice, or a small blueprint that you were told to follow as a little girl or as an adult woman that you've thrown out, and what did you replace it with?
I knew exactly. I was like, the first thing came to my head. I was always told that you should never lift weights, right? You would become so bulky and like muscly, and like all you should do is cardio and run, and that was how you were going to stay fit. That is so not true. We as women, especially as we get closer to menopause, we need to lift heavy weights. Strength training is so important, and that is really integral to us staying fit and healthy many, many, many years to come.
Absolutely, especially in terms of like hormonal health, and there's so many environmental things against us now. It's like we got to stay strong and hormonally supported by it. Like I tell women all the time, especially as a pelvic floor physical therapist, I'm like, you have to get into the gym and you have to lift weights because that's what's going to heal your dysfunction or your symptoms
But
down the
like,
line.
right, we were told like you're gonna get bulky, you're gonna look
Yeah.
like a man, etc.
Yep.
I was a cardio junkie and I have a dear friend who became my trainer and she was like, Jamie, you gotta pick up some weights and do not be afraid about be getting muscle. And I was like, okay, I guess she's right. And she was right.
Yep. And now here we are. And I love that I'm interviewing a lot of more doctors now. And when I grew up, and even like the family medicine practice that I was going to, it's like all of the doctors around me, like, were not healthy. Like even the nurses and nurse practitioners, like nobody around me was healthy. And I'm like,
Yeah.
we're seeing a shift now where like doctors are walking the walk, like nurses are walking the walk, PTs walk the walk. Like I feel like you have to walk the walk when you're in healthcare. It's like otherwise, what are we promoting?
And this is me being a bit biased, but the influx of women into medicine, I think, has changed the face of medicine in many ways. I think that we are more, well, I think women tend to be better listeners, right? But also, I think we brought an awareness to women's health that wasn't there before. And that has really shifted the way we practice medicine.
Absolutely. And we're only going in the right direction. There's a lot being poured into it right now. And I think the shift of, or the help of social media is helping that as well. The good and the bad of social media too, right? So we're on the right track. Well, this was amazing. Thank you so much for your knowledge, for your expertise, for your passion around this topic. And I'm super excited for your book to come out.
Thank you so much.
Can listeners find you, follow your work, or learn from you?
Sure. So, well, my book, like I said, Own Your Fertility, will be available. It's available for pre-order now, but it will be released on January 13th. I have an Instagram page where I try to disseminate high quality information at Dr. Jaime, Jaime Knopman. And I work at a clinic in New York City called CCRM Fertility. There's many clinics of CCRM across the country, and we all do an excellent job treating women and couples who want to preserve their fertility or who have infertility.
Amazing. All right. Well, everyone needs to give her a follow so they can learn more and more about all of the ways to optimize your fertility and not only focus on infertility. It's awesome.
Completely. Yes, exactly. Thank you so much for having me.
Thank you. If you guys like this episode, don't forget to follow the Female Blueprint podcast and leave a 5-star review. It really helps me reach more women who need to hear these messages. And if someone popped into your mind while you were listening today, maybe a friend, a sister, a client, share this episode with them. You never know how much it might help them feel less alone or even be the nudge that they need to finally start rewriting the blueprint for their own life. Thank you for being here, thank you for listening, and thank you for being a part of this community. I'll see you in the next episode.